Good evening, and thank you for joining us for the Marin Healthcare District Board of Directors Candidate Forum, hosted and moderated by the League of Women Voters of Marin County. We welcome our viewers joining us by live stream on YouTube and encourage you to engage in tonight's discussion by submitting questions to mhdtrustees@marinlwv.org. I'm Larry Lewin, a mostly retired nephrologist. I spend my time trying to understand dialysis propositions. I want to thank the committee members and our community outreach partner, Aging Action Initiative, for their support in promoting this event. This year, the League of Women Voters is celebrating 100 years of realizing its mission to empower voters and defend democracy. Moderating candidate forums is an important part of their vision of a democracy in which every citizen has the desire, the right, the knowledge, and the confidence to participate. The League is a strictly nonpartisan organization and never supports or opposes individual candidates or political parties. Before we get started, a little bit about the Marin Healthcare District. Established by the state of California in 1946, MHD is responsible for promoting the health and welfare of the residents of Marin County. This includes maintaining countywide access to care through the Marin Healthcare District health centers and ensuring that the hospital is in seismic compliance and ready to meet the needs of residents in the event of a natural disaster. MHD serves as a strong advocate for high quality care, provides a forum to discuss healthcare issues that affect the communities, and provides oversight of major transactions, board appointments, and the hospital's performance goals. Included in the district's responsibilities is running the Marin Community Clinics, a multi-clinic network and federally qualified health center. This network is the primary provider of health services to Marin's indigent population, serving more than 38,000 patients annually. Congratulations to the district board on completion of the new hospital, the Oak Pavilion. Thank you all so much for participating in our democracy by joining us tonight. And now I hand the reins over to this evening's moderator, fellow League member, Linda Deer.
Good evening. My name is Linda Deer, your moderator for this forum. Thank you for joining us for this candidate forum hosted by the League of Women Voters of Marin County and featuring candidates running for Marin Healthcare District Director. Thank you to our community outreach partner, Aging Action Initiative. Slide 1, please. With me is League member Elaine Biagini as timekeeper. Off screen, we have Doug Cooper and Greg Brockbank to review questions, and Nancy Bell and Robin Dietrich providing Zoom support, along with the team at the Community Media Center of Marin. Thank you. The League is a trusted membership organization that encourages informed and active participation in government. We do not endorse or oppose candidates or political parties. In addition to promoting voter education, the League advocates for issues and may take positions on issues that arise in ballot measures. I would like to remind everyone that the candidates have all agreed to participate under ground rules set for this forum. In order to ensure impartiality, it is the League's policy that candidate forum moderators and question review team members not be actively involved in a candidate's campaign. This evening's forum is being live streamed on the League's YouTube channel, and facilitated through our partnership with the Community Media Center of Marin. This event is also being recorded and will be available on our website at marinlwv.org. For broader community access, a gavel-to-gavel production will be rebroadcast on CMCM TV's Channel 30. Days and times will be posted on our website. I would like to briefly explain the roles of the timekeeper and question review team. To assure our candidates stay within the allotted time, they will see a box designated clock. At the appropriate time, the box will turn yellow, indicating the candidate has 30 seconds remaining for their response. The box will remain yellow for approximately 10 seconds and then will go black. When the box turns red, the candidates should complete the sentence they are on. You may submit your questions to the email address displayed on the screen, mhdtrustees@marinlwv.org, anytime during the forum. Our question review team is standing by to review incoming questions. I want to assure you they do not censor the questions. They simply screen the questions to avoid duplication and check for anything inappropriate. If you do not recognize your question, it might have been combined with other questions on the same topic. Due to time constraints in this forum, we may not be able to pose all questions that are submitted. Slide 2, please. There are 4 candidates running for 2 seats on the Marin Healthcare District, all of whom are with us this evening. Dr. Edward U. Alfrey, Melissa Bradley, Dr. Hank F. Simmons, Harris F. Hank Simmons, and Ann Sparkman, nurse. Thank you. The candidates have been invited to make a 2-minute opening statement. After that, they will each have 1.5 minutes to answer each question. To be fair, I will rotate the order in which they respond to the questions. For opening statements, we will begin with Hank Simmons. Hank, please unmute your mic and then begin your opening statement. Unmute.
Can you hear me now?
Yes.
Okay. Hi. My name is Hank Simmons, and I'll give you a little background. I was raised in Sacramento, but I finished high school in Pasadena, California. And after that, I went into the Army. Spent 2 years, 2 months and 18 days in Germany with the 3rd Armored Division with Elvis. Came back and graduated from UCLA undergraduate, then medical school. And then I came back to Northern California and finished my internship at San Francisco General. And then I did a residency in OBGYN at Kaiser. I then moved out to Marin in 1971. I've been, next July, I will have been here for 50 years. I retired in 2006, and 2 years later, I was asked to run for the Healthcare District Board, which I did, and I was lucky enough to win. It's been an interesting 12 years. We had a very dysfunctional board at the time, and we've cured that. We have done a lot of great things during that time. We have a new hospital, and we are currently fighting COVID as best we can. The plan that I have for the rest of, for the next 4 years is to maintain the integrity and the reputation of the hospital and the district. I have no conflicts of interest whatsoever. And Ann and I are running as a team. We think that we have experience, wisdom, and loyalty to the hospital. and the district.
Thank you, Hank. Next, Ann Sparkman. And just so that everybody knows, Ann is joining us on the phone. Ann, unmute your mic and you can begin your opening statement.
Hello, everyone. Thank you so much for hosting us for tonight's debate. And I want to let folks know that I'm really excited about running for re-election. I've been on the board since 2011. Hank and I are running as a team. He served on the board since 2010, and I have since 2011. We bring stability and experience. And I want to highlight a few of the items of good work that we have accomplished as a productive and collaborative board. We successfully transitioned from Sutter. That was very challenging. And it's a minor miracle that we are here as we are with a brand new state-of-the-art hospital. The hospital opened on September 29th to patients. It's a green facility, healing place, and we're very proud of it. We've also forged a strategic affiliation with UCSF, and I might note that I do work for UCSF as the healthcare attorney. I have no conflicts of interest. I'm not financially tied to the hospital, Marin Health Medical Center. During the transaction stage, I did recuse myself. That's over with. So I just want to note that in terms of conflict of interest. In addition, we've worked to reduce the spread of COVID-19, and Hank and I want to continue the good work. This is a time when we need to bring stability and experience and knowledge. It's critical because we're in a transition period. We have a brand new CEO, Dr. David Klein. It's a brand new hospital, and as we all know, it takes about a year for things to settle down in a new hospital. There's a lot of issues that come up in the first couple of years. We also have a relatively new CFO. And in addition, we're facing financial uncertainty, as most hospitals are with COVID-19. It's really created a negative impact on hospitals, and Marin Health Medical Center is no exception. So I want to turn now to the
Thank you.
experience, what I bring. I've been a nurse for 41 years.
Ed,
I've been a, yes.
okay, we're going to move on. Ed, can you unmute your mic and begin your opening statement?
Yes, thank you very much. I would like to thank the voters of Marin County for their efforts to flatten the curve in the current pandemic by social distancing, frequent hand washing, and most importantly, wearing your masks. Your efforts are critical to the safety of your neighbors and family members and of my colleagues at the front lines of this fight against COVID-19. The current pandemic is redefining how we practice medicine. It is clear that we will never again practice the way that we've been accustomed to practicing prior to the beginning of this year. The way we practice medicine in the future will be defined by those healthcare workers that are currently on the front lines of this fight. As a frontline trauma surgeon, I've been directly involved since the beginning of the current crisis. These changes in healthcare will not only affect the hospital practice of medicine, but equally the Marin community clinics. I'm the only candidate running for the Marin Healthcare District Board with direct involvement in patient care. In addition to my ability to help define healthcare in the Marin due to the pandemic, I believe that we also need to focus attention on the problem of emergency department overcrowding and boarding. Emergency department overcrowding and boarding leads to poor patient satisfaction and also is a patient safety issue. Emergency department overcrowding is related to throughput in the hospital, including early discharges. And I've been on the hospital's throughput committee for 3 years working to try to help solve this problem. Overcrowding and boarding is also related to patients using the emergency department for their primary care instead of primary care physicians' offices and clinics. Not uncommonly, their disease progresses unnecessarily due to a delay in seeking care at their local physician's offices. No studies have demonstrated that increasing the size of the emergency department or the number of rooms decreases overcrowding and boarding. The third important issue where my extensive healthcare experience will help is the continuing development of our affiliation with UCSF. We are very early in this relationship, and my many years of active experience with direct patient care is critical to ensuring a smooth transition. In summary, I have more than 30 years of active clinical experience in healthcare, including a master's degree in healthcare management. This experience will be critical to the future success of healthcare in Marin. Thank you.
Thank you. Melissa, please unmute your mic and begin your opening statement.
Oh, hi there, everyone. My name is Melissa Bradley, and I was born in Marin County. I'm going to call it Marin General Hospital. It's really difficult to call it Marin Health, and I think a lot of the community feels that way. So I was born at Marin General. All 4 of my children were born there. Due to unfortunate circumstances, I am on Medi-Cal, and I believe I'm the only candidate running that is on Medi-Cal. So I have a unique perspective being a poor person in Marin County and using the facilities there. And I also want to point out that I do believe the other candidates do have a conflict of interest. When the original board of supervisors put together the board of Marin Healthcare District, I believe was in the 1950s. All of the board members appointed by the board of supervisors were community leaders and business owners. Now, at the time, they're all men because that's the way everybody rolled in the 50s. But now we have some women on the board, which is great. And Ann and I are the women running this time. But we don't have a community member or a business person on the board. We have people that are all related to the medical field. And at a minimum, we need to have at least one person who can truly advocate for the people and who is not a member of the American Medical Society, which we know is one of the largest lobbyists against the Affordable Care Act and universal health care. So it's like a direct conflict, in my opinion, to have all medical professionals on the board. Thank you.
Thank you, Melissa. All right, now for the questions. We're going to begin with Ann Sparkman. The first question: what in your opinion, are the key priorities for maintaining and enhancing healthcare services in Marin? How would you, as a Marin Healthcare District Director, help achieve these high priority goals? Again, we're going to begin with Ann. Please unmute your mic and begin your response.
Yeah, as a former nurse and as a nurse with a public health certificate, I take public health very seriously. And the role of the district is to serve all residents of Marin in terms of their health, not just the patients of the hospital. I believe that we need to focus on social determinants of health. And quite frankly, before COVID-19 came in on the picture, that was where we were headed. Now we are doing that. We have a newly formed social determinants of health task force that is meeting in early November, and it's going to be very exciting work, and it will assist us in determining priorities in terms of improving access to the hospital for our patients, as well as other items in terms of assisting folks getting to the hospital or for visits with transportation, meals to seniors, et cetera, et cetera. Those are my goals in terms of public health for all of our residents. In addition, we need to get a handle and learn from COVID-19. This is going to be the future for us. We're going to be living with pandemics in the future, and we need to be prepared for that. We've learned a lot from COVID-19. As a nurse with an infection control experience, very solid experience, I bring that expertise to the district in terms of reducing the spread of COVID-19. Thank you.
Thank you. Ed, please unmute your mic and answer the question, please.
Thank you very much. I think the most important thing in the near future is making sure that the patients and the healthcare workers in Marin are safe, because we are very early in this pandemic and there is a lot to learn still. I believe that as time goes on, there'll be thousands of research publications. We'll all need to digest those and figure out what works in Marin. I received a Legacy Award in 2017 for my service to the uninsured. And I think that continuing to make sure that all residents of Marin have high quality healthcare is critically important. We also have to make sure that the patients are properly using the Marin Community Clinics. The system is outstanding. The physicians that work there and the healthcare workers are outstanding. And I think that too often the patients don't realize the opportunity that they have to get their primary care there before their diseases progress. The financial stability is also very, very important, as others have mentioned. And there's a lot of ways to help solve the financial stability problems that we have. Most importantly, we have to make sure that what we're doing as we change our needs and our processes with this new pandemic is we have to make sure that we have safe but fiscally sound processes. Thanks very much.
Thank you. Melissa, I think you could please unmute your mic and answer the first question. Unmute your mic. Unmute your mic.
Oh, okay.
Thank
Sorry,
you.
that was for fun, just saying that I'm not a doctor. My little prop here. Okay, could you please repeat that question for me?
Sure. What, in your opinion, are the key priorities for maintaining and enhancing healthcare services in Marin? How would you, as a Marin Healthcare District Director, help achieve these high priority goals?
Okay, thank you, Linda. So I have a completely different platform from all the other candidates. Everyone that's running, they seem to be kind of just regurgitating what the corporate board is doing. You know, they're like, they want to continue on with COVID-19 and they want to continue on with the construction. And so the Marin Healthcare District Board is an oversight board for the corporate board. So my goals are all related to oversight. Number one, I would like to know, because the other candidates running here have already stated that they were concerned about financial problems with the hospital, and I'm assuming they are referring to the COVID effect. But my understanding, based on reviewing the financials of the that are available on the website, by the way, the 2020 financials are not available, which is not transparent. But the 2019 financials state that there's assets in excess of $500 million. So I'm wondering how much trouble the hospital is really in, and why are you soliciting the public repeatedly using COVID as a mechanism to solicit people when really people are giving up their hard-earned money, and the executives are earning huge salaries and bonuses, including the CEO and CFO that just left.
Thank you. Hank, please unmute your mic and answer the first question.
Okay. Melissa is absolutely right. The responsibility of the district is overseeing what happens with the hospital. That's number one. The second thing that it does is it promotes education opportunities for the public on medical issues of different kinds that are very important generally and specifically for Marin County. The biggest one at the moment is taking care of the pandemic as best we can. The district has put together a task force, and we are helping the county promote various kinds of things that will get rid of this virus. Well, I don't know if we'll get rid of it. We're going to need a vaccine for that. But that's one of the things. Those are the three things that we're doing.
Thank you. The next question, we're going to begin with Ed. The question is, what do you see as the primary benefits and possible drawbacks to the Marin Health partnership with UCSF Health? How do you see that integration going forward? And Ed, please unmute your mic and answer that question.
Yes, thank you very much. There are a lot of benefits to aligning with a large medical center like UCSF. The first one is easier access for our patients that to access services that they don't have at Marin. Another benefit is not necessarily for the patients, but for the physicians and healthcare workers to utilize the expertise at UCSF for other services, for consultation and that sort of thing. As we've seen with this pandemic, we've been able to rely on UCSF for help with our testing of the COVID patients. And I think that's very, very important. One of the things that we just have to be careful about, one of the things that the local physicians have been concerned about, is encroachment of their practices by physicians at UCSF. We haven't really seen that, but I do know that the physicians have been very concerned about that. So I think that managing all those processes is very important. We have had the opportunity where we've recruited into the medical community younger specialists that where we don't have a more senior specialist, and we've been able to rely on UCSF large faculty to help mentor younger faculty or younger physicians as well. So there's a lot of very important benefits.
Thank you. Next is Melissa. Please unmute your mic and move on to the question.
Okay, well, as a community member and not a board member, obviously I have limited information as to how the liaison is working out, but it would seem on the surface that it's a good thing for the patient to be able to go to the high quality doctors at the UCSF. But however, I do agree with Dr. Edwards' point that it can be hurting the community doctors that are in private practice here. And also my main concern, and this is kind of throughout, is the referrals. Like for instance, Dr. Brian Hugh, I think his name is, Sue, was elected a lot in the last election, and he has a spine clinic. And so my concern, and what I would want to investigate if I was elected, is how are these referrals happening, and is there more involved with that? I'm really into the investigating and getting down to the why answers. And I think that's extremely important for the community.
Thank you. Next, we'll hear from Hank. Please unmute your mic and give us your response.
With respect to UCSF, we hooked up with UCSF starting in 2017. We got a letter of intent in November of 2017. We signed the contract with UCSF in the 31st of August of 2018. We received UCSF committed itself to $110 million toward helping produce joint venture projects. And there is, and this is ongoing. These are being worked out. This is a contract that extends for 10 years. And the projects that have been done as the NICU, newborn intensive care unit, pediatric diabetes, cardiac surgery, and they're working now on ortho. We are getting Epic information systems, which is going to be much better than what we have now. The clinics already have the Epic system. They're going to be working on oncology, neuroscience, orthopedics, cardiovascular problems, general surgery, ambulatory surgery, and other things that are coming down the road.
Thank you. Anne, it's your turn. Please unmute your mic.
Yes, I see quite a few benefits with the UCSF Strategic Alliance. As Hank mentioned, the improved electronic health record, that's a huge improvement. The UCSF has a very good program with population health, and that's something that Marin General, aka Marin Health Medical Center, could benefit from in terms of residents of Marin County, in terms of helping them prevent sickness rather than going to the ED or the hospital. That's another benefit. The specialty areas, as Ed noted, is another benefit. And I need to mention that with the task force that's headed up by Dr. Sue, that we all voted for, I was able to pull Dr. George Rutherford, he's the expert in epidemiology with COVID-19, to serve as a consultant. So that's been very helpful for the district. In addition, in the future, we are told that there will be collaboration and availability for patients to enroll in clinical trials, and also for the training for residents and fellows. So I see a lot of a benefit there. Thank you.
Thank you. And as a reminder to our viewers, you're invited to submit questions to mhdtrustees@marinlwv.org. Okay, moving on to the third question, and we're going to begin with Melissa. Already, the COVID-19 pandemic is driving many people out of work, out of employer-based health insurance, and into emergency care. At the same time, there are significant new constraints on Marin County revenue. What is your outlook for the Marin Healthcare District budget? And how are you planning to handle this new financial reality?
Thank you, Linda. So again, I want to just repeat what I just said earlier, that the last budget that's posted on the website is the 2019. By the way, I think also I want to mention that Marin Healthcare District is a separate entity from the hospital board, and they used to have separate websites, and the Marin Healthcare District website was really lacking. Now it's all combined. So if you're just a regular person and you're going on Google and you go to Marin Healthcare District to find out information, boom, you're on the corporate website. And that shouldn't be like that. There's a whole lot of stuff. Why was the CEO of the corporation put into the Marin Healthcare District board? It doesn't make sense. So my point is, I think this is being exaggerated, and that the corporate executives are soliciting the public unnecessarily, and actually, I believe fraudulently, with the premise that it's for COVID-19 supplies. Really, they're asking for it to go to the general fund, and that is supporting salaries of executives, bonuses of executives. The bonuses of executives should be forfeited at this time, in my opinion. And I'd like to ask the board, have they asked the executives to forfeit those hundreds of $1,000 bonuses and over $1 million salaries at this time? Why are you soliciting the community for donations when, according to the website, the last posted budget was over $500 million in assets? $500 million in assets.
Okay, we're going to have to move on. Thank you. Hank, you're next.
Would you repeat the question, please?
Sure. Already, the COVID-19 pandemic is driving many people out of work, out of employer-based health insurance, and into emergency care. At the same time, there are significant new constraints on Marin County revenue. What is your outlook for the Marin Healthcare District budget, and how are you planning to handle this new financial reality?
Good question. We're going to have trouble. There's no doubt about it. The hospital's in trouble, and the district that does not have an awful lot of funds is doing the best that it can. It has contributed or we haven't, but we've committed ourselves to about $1 million worth of help to the task force to deal with this virus. You're right that this virus is creating havoc physiologically and psychologically. People are going nuts. Our budget, the money that we have is not a lot. The district does not have a lot of money. We have committed that the district does not, I'm sorry, but the district does not have a lot of money. We have contributed 1/5 of our resources toward the pandemic so far. What are we going to do in the future? Do the best we can.
Anne, you're next. Please unmute your mic.
Yes. In terms of COVID, very good question, as Hank pointed out. We have a lot of residents who are out of work, don't have their group insurance through employment. And Marin County, as you said, does have its constraints. And as Hank just mentioned, the district has its constraints as well. And we have put a lot of funding in place for these projects for COVID-19. The triage kits, as well as the testing, and the testing now, as you know, in the skilled nursing facilities and congregate living, that is pivoting now over to aftercare after folks are diagnosed with COVID-19. Now, the district put a lot of money into it, 1/5 of our budget, as Hank pointed out. And what's really disappointing is that Kaiser and Sutter has not helped. They are major health systems. They have a lot of extra money, and they have not helped. So we need to lean on the Sutters, the Kaisers, to do their fair share. I have to say, what's happened with COVID-19, a couple of interesting things that have come out of it is our learning that we can provide telehealth that improves access, it improves quality for our residents, their health, etc. But the other learning is that we need to cooperate and not compete. And that's what we've always done as hospitals in the past. We've always competed with each other. We now need to cooperate, and we need to get the other hospitals and health systems to join in with all of the work with COVID. Thank you.
Thank you. Ed, please unmute your mic.
Thank you very much. Your question actually is the reason that I went back to school and got a master's degree from Harvard in healthcare management, because it was very clear in the 90s that people that were running hospitals either knew nothing about medicine or they knew nothing about business. I didn't get a graduate degree so I could become a business person. I got a graduate degree so I could help the hospitals and systems that I work in be more fiscally sound. There are many things that we could do in Marin Health Medical Center to improve our revenue. We can do a better job with capturing charges that are sitting on the table because we haven't coded properly, and that will take a lot of education, but there are many things that we can do to help. As we redefine healthcare in the future because of this current pandemic, because this won't be the last time we'll be faced with something like this, we also need to make sure that we're doing things that are not compromising patient care, but also are fiscally smart. And that just takes a deep understanding of the biology of disease, as well as understanding of systems that we have to make sure that we're efficient. So there are many ways that we can help improve this financial situation we're in. Every system that I'm aware of is currently struggling with the same problems.
Thank you. The next question, we're going to start with Hank. What influence can Marin Healthcare District have to attract new doctors who want a career in Marin County? Specifically address physicians, family physicians, and psychiatrists willing to serve Medi-Cal and Medicare patients. Can you unmute your mic, Hank? And unmute your mic, Hank.
Okay, I pressed the wrong one.
Got it.
Okay. What can we do to attract physicians? Well, the district has already done quite a bit, actually. We set up several years ago the 1206B clinics that kept the physicians, primary care, and others in the county that were threatening to leave. This was set up by through the district by Lee DeMonico, our CEO at the time, and it worked very effectively in keeping the people here, the doctors here that we wanted to maintain. What are we going to do in the future? I think we've got it under control, although the 1206B has now become a 1206G, which is under the control of the foundation and UCSF. As far as the psychiatrists are concerned, we want to keep those going too. The district has been contributing to the psychiatric department in Marin General Hospital, and we've been contributing every year. That is the district alone, and we will continue to do what we can.
Thank you. Next, we're going to move to Anne. Please unmute your mic.
Yes. Thank you very much. Yes. In order to recruit younger physicians, one of the barriers, fairly obvious, is the high cost of living. And I'm sure, Melissa, you can attest to that in your profession, that we have worked on with our physicians who move here, and that's been successful. We also, in terms of psych and Medi-Cal, for the hospital, the inpatient unit at the hospital, that's the only inpatient unit from the Golden Gate up to Oregon that accepts Medi-Cal patients. So the hospital is already doing quite a bit in terms of access for psych patients. The problem, though, is a lot of counties outside of Marin send their patients to Marin, and so then there's no room for Marin County residents. That's something that we are continually struggling with, and those are discussions that we have regularly with Marin County. But we do, as a district, what we have done in terms of psych and attracting younger physicians is we have supported, the district has provided funds to support the psych hospitalist program, as well as our outpatient psych clinic. And we've been doing that until the psych program has enough work and can build the practice. So that's what we've done in terms of psych. In terms of primary care, we need to do the same thing. We have a lot of young families, and for primary care, that includes not only family medicine, but also pediatrics. So we have work to do in that regard. Thank you.
Next is Ed. Unmute your mic. Thank you.
Thank you very much. I think your question was what influence the district can have on attracting new physicians into the community. I'm the chair of the board of Premium Medical Group. The year before I came on the board, we had lost 20% of the physicians out of the county. One of my priorities as the chair of the board was to do whatever we could to recruit new physicians, particularly primary care, into the county. And recently we've added about 10 new physicians, mostly in primary care, through very aggressive recruiting strategies. One of the things is that we feel it's very important to support them as a community of physicians. So we make sure that we have good liaisons with them, that they have mentors that they can work with. We need to make sure that we provide financial stability, and partnering with the hospital has helped in that tremendously. We also need to make sure that they get incorporated into the community so that they feel very comfortable here, that their kids are in schools here and they want to stay here, because the worst thing is to be able to recruit people and then have them leave. One primary care physician contributes about $1 million in revenue to other services in the community. And so just by having new physicians in the community, we're also supporting the community that they serve. So we've been very aggressive at Premium about recruiting new physicians and been very successful.
Thank you. Melissa, unmute your mic and it's your turn.
Hi, thank you. So in terms of attracting quality doctors, I wouldn't necessarily say younger, just quality doctors and other medical professionals to the hospital and the other facilities in Marin Healthcare. I I think it's so simple, and I ran a very successful business for nearly 3 decades, and it was awarded best place to work in the Bay Area, best place to work in the North Bay, repeatedly, and best company repeatedly. And it's really simple. You take care of your employees, and that means salaries, nice salaries for the nurses and the doctors. And when I was there not that long ago, there were travel nurses still at the hospital, and I'm just kind of in shock about that. Why are we having travel nurses at our community hospital when we have people right here in our community that would like those jobs? The bottom line is because the whole system is set up to make a profit for the hospital, but the profit for the hospital is not being reinvested in the community alone. It's being paid out in salaries and huge bonuses, which none of my competitors here want to talk about. The huge bonuses and salaries. I'd like them to make some comments on those $1 million salaries of the executives. And by the way, one of the executives on the board who was a contributor of $1 million to the project for the uh, what is it called? The I know you guys can't answer the
Well, when it comes to you, just let us know at another
Oh,
response.
sorry, it was diabetes. Okay, so Bruce Braden donated, and he also bequested after he dies 21 million. So it wasn't given to the hospital yet, but he's kind of running the show over there in terms of a lot of things. And I want to make note that I did some investigation, and he's one of the largest contributors to the Republican campaign for several decades. He's been a
All right. Let's move on. Sorry about that. Again, as a reminder to our viewers, you're invited to submit questions to mhdtrustees@marinlwv.org. The next question, we're going to begin with Anne. The question is, what gaps in healthcare services do you see in Marin? And how might those gaps effectively be filled? We're starting with Anne. Please unmute your mic.
I caught the first part of your question, the gaps in healthcare services. I didn't catch the second part.
Sure. What gaps in healthcare services do you see in Marin? And how might those gaps effectively be filled?
Okay. There appear to be gaps in certain areas in Marin, such as in Marin City, in the Canal area. Some of those gaps have been cured with the Marin Community Clinic, and I used to be a board member for several years with the Marin Community Clinic, and really am very proud of the good work they do. But it's not enough. We need more service agencies to provide care. Another way to improve access, and now that we've had experience with telehealth with COVID-19, those can be ways of expanding access. And I have to say that Kaiser has done this very successfully with telehealth, not only with video visits, but also with the telephone visits, and those could be used to cure gaps. We need more Marin community clinics, quite frankly. And in terms of services in the clinics and in the hospital, you know, we need to really look at our charity care policy and make sure that we are not sending onerous bills to patients who are receive care in the clinics as well as the hospital, particularly now with COVID-19, with so many folks being out of work. I believe that there is improvement to be had in terms of the bills patients receive. As a nurse, I'm a patient advocate, And that extends not only before they go into the hospital in terms of public health, but when they're in the hospital and the care they receive, quality, safe patient care, it also extends to the time they receive their bills, and they are dealt with in a very fair manner. And there is law in California, Hospital Fair Pricing Act, that governs billing patients, not sending them to collection to that nature. So I think we should finish that work.
Move on. Ed, you're next. Please unmute your mic.
Thank you. The question, I believe, was what gaps are there in healthcare in Marin and what we can do to help fill those gaps. One of the things that we realized early on was that there was a fair out-migration of primary care from Marin into the city, and we've been trying to address that by increasing the recruitment of primary care physicians in Marin. Another area I think we've already done very well in, and I agree Kaiser has a very good program, but we have a very good program with in Marin Health Medical Center with telehealth as well. Ours was set up very, very quickly and has been very, very successful and has been utilized by a lot of patients in the Marin Health system. Utilization of Marin Community Clinic is a major area where I think we can make a lot of improvement. The problem when patient gets their primary care in the emergency department is it doubles or triples the cost of care. So we can not only help the hospital with the revenue stream that they have by making sure that the patients that need their primary care get primary care at the Marin Community Clinic, but it's also better for the patients. We need to make sure that they feel that it's safe there, that they can go to the clinics without having to worry about getting COVID or other things, and also help them utilize the telehealth systems that work very well right now.
Thank you. Melissa, please unmute your mic and move on.
Hi, thank you. So the articles of incorporation in the bylaws for Marin Healthcare spell out that the mission of the hospital is to support the entire community of Marin. And that's not what's happening. Unfortunately, and this happens a lot in corporations, whether they're profit or nonprofit, is that it becomes all about the profit for the salaries and the bonuses for the executives. And nobody else here wants to talk about that. I want to know if the board has asked the executives to forfeit their bonuses this year. Why are they soliciting the community? The profits from the hospital are to be reinvested. That's why we do things like we have the construction ongoing. But hospitals are one of the largest contributors to greenhouse emissions. And that doesn't include just number 1 and number 2. It also includes number 3, which means that the subcontractors of the hospital need to be analyzed. We need to take a look at how is Marin County contributing to the greenhouse problem? Are we being a part of the problem? Or are we helping solve it? And when the bottom line is all about profit, which it is now, because nobody's looking at oversight, nobody's caring about our community there, you're all looking out for the profit. We don't have that. Even if you're doing number 1 and 2 for greenhouse, you're not doing the services like the ambulances and the
Okay,
other.
we have to move on. Hank, please unmute your mic.
Okay, I don't think there are a lot of gaps in Marin County. Those gaps that may be there are a lot of the super specialties, and with the help of UCSF and this program that we've had for the projects, we're going to fill those. I think the biggest and most glaring deficiency that we have in this county as elsewhere within the nation, and Melissa will agree with me, is psychiatry. We do not have enough concentration on people who have psychiatric problems of all kinds, all ranges. The insurance companies don't seem to pay much attention to this, but it is extremely important. And it's even more important now with the pandemic because people are going nuts. So I think, what are we going to do about it? I think the best thing is to educate the public about the importance of this and have them apply the pressures where it needs to be, so that this can get done. We definitely need an improvement in our psychiatric level.
Thank you. Next question, we're going to begin with Ed. The question is, what do you see as the major issues facing older adults, especially those with disabilities, and how should the healthcare district address them? What specific steps would you recommend to provide adequate geriatric care? Ed, please unmute your mic.
Yes, thank you very much. Major issues facing older adults. Well, first of all, I think as we've talked about with other components of the population, access to care is very, very important. One of the things that we've been doing in the trauma services is we have a matter of balance program, because a lot of the admissions we get into the hospital are just simple ground level falls. And we have patients that are coming into the hospital that are falling on their thick carpeting, or they have homes that aren't set up for adequate care. We do need to do a good job of making sure that when patients are at home, that they have the right resources to make sure that they can maintain their health. As far as getting adequate meals, getting their medications, and then timely visits to their doctors. And I think that those are not necessarily unique to our community, but I think that because we do have a population that does live healthy for much longer around here, it's very, very important that we focus on some of those things for our aging population.
Thank you. Melissa, unmute your mic.
Hi, thank you. I want to also mention that my mother is a longtime resident of Marin County. She's 75. I want to, so I have a personal interest, but I also have an interest for the community. And I think that's been evidenced by my generosity for decades to the community. I think most people know my company, Bradley Real Estate, donated hundreds of thousands of dollars to support charities. So I want to go on to something that's interesting to me, and I really think there's a lack of transparency, and this affects the care for everyone, not just the seniors. My Healing Place, does that ring a bell? It was a marketing campaign that the hospital put out, and I'd like to know exactly, because there's no transparency on the website that I can find, how much money was spent on all those slick mailers that went out, and the ads on the bus. My Healing Place, was a private marketing company hired to do that? Is anybody going to answer my questions here? I will, if I'm elected, I'm going to get along with the board members, but I'm going to ask the tough questions that none of the people that are tied in and kind of chummy with the executives over at the hospital board are going to, if they're playing golf and they're lunching with the executives, they're not going to be maybe asking these tough questions. I have no ties to the medical field whatsoever. I have no conflict of interest whatsoever. I'm not friends with anybody on the executive board. And so
Okay, we're going to move on to Hank. Unmute your mic. Got it.
Okay. Could you repeat the question, please?
Sure. What do you see as the major issues facing older adults, especially those with disabilities, and how should the healthcare district address them? What specific steps would you recommend to provide adequate geriatric care?
I'm not a geriatrician. The hospital, the district does not directly involve itself in this area that I know of. I know that lots of things are necessary for folks that are getting older, because I'm one of them. We will do the best we can, and when subjects come up, we'll deal with it.
Okay, Anne, you're next. Can you unmute your mic?
Yes, thank you. Yes, I do believe we are an aging population in Marin, and I have given this a lot of thought because I'm entering that era. And parenthetically, the district years ago, before we started funding the psychiatric program at the hospital, we funded agencies that worked with seniors and folks who are disabled who needed help in their homes in terms of meal delivery, check-ins, make sure they're okay. A great deal of that work was needed with seniors in West Marin, where it can be quite rural and folks can't just get out of their homes. So we've done that work, and I do have an interest. There is an agency in Marin that Trish Hibbins has formed, Senior Homes, where they encourage seniors and those who are disabled to remain in their homes by providing these sorts of services. You know, things like the grab bars in the bathroom. It's almost like you're no longer baby proof, you need to elder proof to guard against falls. And as Ed said, that is a major issue with the elderly. So I see a lot of work that we can do in that area. And quite frankly, the reason that we're seeing a shift in the finances at the hospital is not only because of COVID-19, but because the population is graying and we have less of the commercial payers now and more of the Medicare. So it's all kind of tying together if you connect the dots. Thank you.
Thank you. The next question, we're going to begin with Melissa. The question is, in your view, does Marin Health play a role in making healthcare equitably available to all county residents? If so, how do you see the district accomplishing this goal? Please address the undocumented, uninsured, and underinsured in your response. Melissa?
Thank you. So this is thank you. So this is very on point on my my candidacy. I am on Medi-Cal. I'm pretty sure there's no other candidate on Medi-Cal that's running and nobody else on the board. I have firsthand experience with using the services of Marin Healthcare District as a Medi-Cal patient with the insurance that's provided by the government. And I would be an advocate for poor people and for the elderly. There needs to be somebody on the board that's just kind of a normal person. And I'm a normal at this point in my life due to unfortunate circumstances in my divorce. And I've lost my corporation in my divorce. So I have nothing, basically. I had to go, I'm doing a bankruptcy, and I can advocate for the poor people of Marin County, which right now that's not happening. And anybody can look it up online, or you can talk to doctors and nurses, that there's not a lot of profit for the Medi-Cal patients. And so they are treated differently. It's not the same. And, you know, nobody wants to talk about it publicly, but they'll tell you in a whisper. They'll tell you the truth. If you ask, they're going to tell you, and you can research it yourself online. So there needs to be somebody advocating that the bottom line of the hospital is not the profit, so that the executives can make money. And I know I sound like a broken record, but
All right, we're going to move on now, Hank.
that's my point. That's my point. Thank you.
Repeat the question.
Sure. In your view, does Marin Health play a role in making healthcare equitably available to all county residents? If so, how do you see the district accomplishing this goal? Please address the undocumented, uninsured, and underinsured in your response.
The only way that I can see that this can be achieved is dissemination of information. The people have to know what the resources are, and because they're there. The community clinics have done a great job down there in the canal area, and we thank them for everything that they've done. The Spanish-speaking people that work down there have helped tremendously getting that information out. That's the only way that I can think that the district can get involved, is to disseminate information.
Okay, Anne, Unmute your mic, please.
Yes. I'm going to separate this into two questions because part of the question was to Marin Health, the hospital, and the other to the district. In terms of Marin Health, I spoke previously about folks who are underinsured or insured and the need to review the charity care policy and make sure that it comports with or complies with the Hospital Fair Pricing Act. And the other part of it with respect to the district is that I agree with Hank, the Marin Community Clinic has done a great job, but we need more. And they also need, they're backed up, patient navigators to assist folks, you know, with the system, with Marin Community Clinic and getting into the clinic. It's really a long wait, as well as providing interpreting and translation services. The district has, as I mentioned earlier, has now a task force on social determinants of health. And that will go far, far, far in terms of assisting those who are underinsured, uninsured, undocumented, in terms of providing equitable care. In addition, and as Hank mentioned, we have a number of educational forums and we get a good turnout, and it's really rewarding to see the audience when we were in person and how they were able to share stories, share resources. We need to do more of that. And if we need to get more funding to do that, we need to find donors. This is a very wealthy community. There's no reason why we have this inequity between the very, very rich and the very, very poor in terms of health care. It is not a privilege, it is a right. And I'm a very strong advocate for that. Thank you.
Thank you. Moving on, Ed.
Yes, thank you very much. Does Marin play a role in making healthcare equitable to all? I think every healthcare provider has an opportunity to try to make that make a small contribution. As I mentioned earlier, I received a legacy award from Operation Access a couple years ago for care given to the uninsured. I also spent about $10,000 of my own money a year ago when I went to Guatemala up into the rainforest to provide surgical care to patients there. That also helps care in the United States because some of those people will immigrate up here. You did mention immigration. You know, I think that it's very important that we let the patients know that it is safe to come to the clinic, not only because of COVID, but because it's a safe place for them to be. I did notice a very dramatic change in patients' responses to my question. When I ask them where they're from, I always am interested where they're from because a lot of diseases have geographic importance, particularly hepatobiliary diseases in Latin American patients. And starting around the time we had a new president, all of a sudden people were very, very guarded and very defensive when I would say, where are you from? They would say things like, well, I belong here and I'm supposed to be here. And I would just smile and say, I'm not asking you because I'm concerned about your immigration status. I'm asking you because I'm interested in healthcare that might affect you. So I think communication is very, very important. The information channel, as mentioned, is important. I think we can all do better in that regard.
Thank you. Next question, we're going to start with Hank. Please share your perspective on the division of responsibilities between the Marin Healthcare District and the hospital, now Marin Health Medical Center. What, if anything, would you change in the current structure?
Well, we have kind of a unique structure because we have two boards. As Melissa had pointed out, we have a district board, which is elected, which is what we're doing right now, and the hospital board, which is appointed but okayed by the district board. We are the overseers. This has turned out to be a very effective situation. The history goes back to the 70s and 60s even, with the district board running or trying to run the hospital. We had some very dysfunctional people on there and the whole board was awful. It was the laughingstock of Marin County for many years. we put an end to that. The system now that is set up is very effective and working very well. We have our problems, but we're working on it and we'll get there.
Thank you. Anne, unmute your mic.
Yes, thank you. Yes, as Hank pointed out, historically, the Marin Healthcare District Board was contentious and not productive and not effective. And this was cured with the implementation of a firewall between the district board and the hospital board, and it's been very effective. The district owns the hospital. The district is the sole corporate member of the hospital board. The district has oversight responsibilities. We don't get into the minutia of the hospital operations. We do, however, when there are problems that arise, but routine day-to-day operations, we do not. We're an oversight body. We get involved with governance as well. I cannot see anything that would change, quite frankly, in the current structure, but we need to do a re-review of the bylaws, both for the hospital board and for the district board in an organic fashion, because we've been separated from Sutter since 2010, and the bylaws were written, from what I understand, with great care, but 10 years later, you're going to see some issues that need to be addressed. So that's what I would advocate for, would be to do a page-by-page revision to both bylaws to ensure that we're not missing any opportunities to improve operations both on the district side as well as on the hospital side. Thank you.
Ed, unmute your mic. Unmute your mic.
Oh, sorry, I pushed.
You're unmute again. Now you got it.
Perfect, thank you.
Nope.
I'm not sure why that's not staying unmuted. The division of responsibilities between the healthcare district and the hospital. As has been mentioned by all of the other participants, the healthcare district board should provide oversight. And it's also clear from some of the discussion, whether that's happening would be a little bit debatable. I personally think that it does work very, very well. That doesn't mean that there are things that can't be improved, but I think that the current function of the district board with oversight of the hospital functions very, very well. I learned many years ago in business school that just when you think everything is perfect, that's the time to reevaluate it. And as Ann said, I think it's probably time to relook at the bylaws of both the district board and the hospital board and the oversight.
Thank you. Melissa?
Hi, thank you so much. So, oops, am I on?
Yes, you are. Now you're not.
So this is a point that I made when I ran in 2018, and it wasn't, I guess, understood clearly enough, that this is an oversight board, because a lot of the questions that were thrown at the candidates were questions that the candidates have no control over if they're elected to the board. The executive board on the hospital are the decision makers. And I want to make a point that I've researched a bit. And one of the people that is on the executive board, Bruce Braden, is making a lot of decisions over there, and he is in the oil industry and coal and shale mining industry. And this is kind of a direct contradiction to the constituents' values of Marin County, where we're really a green county. And in order for our hospital to really be a green hospital, we need to have executives on board with that philosophy. And it appears as though that's not the case. And we really need to examine that. And the oversight board, which if I'm elected to the oversight board, the Marin Healthcare District Board, I would be directly involved in that. I'm fearless, as you can tell. And those things need to be addressed. We need to be a leader in green. for the hospital. The hospital's healthcare is one of the biggest contributors to greenhouse emissions.
Okay, we're going to move on. This is the last question, and we're going to start with Melissa. No, we're not. I did that wrong. We're going to start with Anne. Sorry, it's looking in the wrong place. And here's the question. In your view, what lessons have we learned from the COVID-19 pandemic? And how might the district use this gained knowledge to improve healthcare services in the future? And again, we're going to begin with Anne. Please unmute your mic.
Thank you. The pandemic has brought memories to me of the AIDS epidemic in the early 80s when I was an infection control nurse at Kaiser Foundation Hospital in Oakland. At that time, we knew nothing about what caused AIDS, how it was transmitted. With COVID-19, we know a lot about the transmission. However, this virus is so unlike anything that we've seen before that it's going to take us a long time to really understand this. And I think Ed spoke to that earlier with the medical literature and all the studies and such. I think what we need to, lessons that we need to learn are cooperating with other hospitals, not competing. I said that before. Improved access with telehealth. Early warning signs should not be ignored, and important epidemiological programs need to stay on course. And that is more at the federal government level than here in Marin. But I do believe in Marin, Matt Willis has done a phenomenal job, and he will continue to do so, working with UCSF, Dr. Rutherford, the task force, so that we can continue to learn from this epidemic. But we cannot lose sight of it. This virus is mighty. It is fierce. And the sequelae, the medical sequelae, are just really damaging hearts, brains, creating clots. It's something that we need to take learnings from and be prepared for the next pandemic, because there will be one. That's guaranteed. Thank you.
Ed, you're next. You got it.
Thank you very much. I would have to agree that this pandemic is like something we've never seen. I have also lived through the HIV and the hepatitis C. During those time periods, I was a transplant surgeon, and we were at very high risk for getting infected from those diseases. But we haven't seen anything like this before. There's been about 25 million deaths from HIV over 30 years. There's already been 1 million deaths worldwide in less than a year from this current pandemic. I think the things that we've learned are that we need to be, first of all, we need to be prepared to act immediately when something new comes up. I think we also need to recognize that on any given day, on any given night that we're working in the emergency department, or even in the clinics, patients could come in with diseases that we're not quite ready to deal with. And so we've all learned to be very, very careful. I remember very early in this pandemic, I was wearing a mask around the hospital and all sorts of protective gear because we didn't know anything about it, not because I knew something that nobody else knew. So we have learned that we need to be very, very careful. We need to protect ourselves as well as the patients in this current crisis.
Thank you. Melissa, you unmute your mic.
Thank you. Will you please repeat the question?
Sure. In your view, what lessons have we learned from the COVID-19 pandemic? And how might the district use this gained knowledge to improve healthcare services in the future?
Okay, thank you. So, well, I think we learned, just like many of the hospitals throughout the world, really, that we were unprepared on a lot of levels. However, I think it's been a little bit blown out of proportion when the solicitors on the executive board have been soliciting the general public for donations under the guise of COVID-19, and then suggesting that the money go to the general fund, which the general fund can go to the executives. It's all everything is linked together, and I think that there's a very huge lack of transparency. There's no explanation for this gigantic campaign, which, by the way, this is my point. We need to focus on the patients. The whole problem for this and many other issues could be solved if we're focusing on the patients, which includes quality doctors, meaning quality salaries for the doctors and nurses and all of the other medical professionals, really supporting those people so that they can support the patients and not spending, I don't know, millions of dollars on a marketing campaign. Are you marketing for sick people? This is your healing place. Why was the hospital spending money on glossy postcards? Why do I get postcards in the mail saying this is your healing place, and at the same time you're soliciting for donations? I don't understand that.
Okay, moving on. Hank?
This pandemic is 100 years from the last pandemic, the Spanish flu back in 1819, during which I think 50 million to 100 million people died. There wasn't a communication system then. People didn't know to the degree that we know now all of this information, and the information that we are gaining about pandemics is huge if people will pay attention to it and do it. As far as the district is concerned, the thing that impressed me was the response that the district took toward helping this. We set up a task force that came out and did what it could with the finances that we could produce, and also Brian Sue did a hell of a job putting everything together. So we've learned a lot.
Thank you. That concludes the question portion of this forum. Before the candidates make their closing statements, I want to share some key information about this year's election, particularly on how and when you can vote. We are fortunate to have an outstanding elections department in Marin, headed by Registrar of Voters Linda Roberts. Be assured that the counting of ballots for this year's election is being conducted with the highest level of security, honesty, and integrity. Election Day is officially November 3rd. You have until October 19th to register. After that, you will have to go to the elections office to register and vote in person. Due to COVID-19 and the need to ensure safe, accessible voting, the state of California has implemented new expanding voting options. Slide 3, please. All active registered voters in California will automatically receive a ballot in the mail. Vote by mail ballots were mailed out to Marin County voters last week. Voting by mail, now underway, is the safest way to vote during this pandemic. You have several options for returning your completed ballot. You can send it through the US mail, postage paid. Mailed ballots must be postmarked by November 3rd and received at the elections office no later than November 20th. You can drop it in any one of 12 secure drop boxes located around the county. A list of authorized drop box locations is included with your ballot. In addition, you can hand deliver the ballot to the elections office at Civic Center, starting now, or to any polling place once they are open. Slide 4, please. If you are voting in person, note that as a result of recent legislation, there are fewer polling places for this election. Your assigned polling place is printed on the back of your sample ballot that you received in the mail. Be sure to check this before heading to the polls. Your assigned polling place may be different from past elections. There will be 29 consolidated polling places open for 4 days, October 31st through November 3rd. Masks and social distancing will be required, and a limited number of people will be allowed inside at any one time. It is also possible to vote in person at the Elections Department in Civic Center during regular business hours from now to Election Day. New legislation allows processing of ballots to start as of October 5th. Vote by mail ballots are counted as they are received in the Elections Department. Counts from ballots received 3 to 5 days before the election will be included in the election night results. Make a plan now and vote safely. For more information about Dropbox and polling locations, you can go to marinvotes.org, or you can call 415-473-6456. Thank you. At the end of this forum, there will be a slide listing several additional websites that we recommend for more detailed election information. And now the candidates will make closing statements of 1 minute. We will go in reverse order of the opening statements, starting with Melissa Bradley. Melissa, unmute your mic, please. Got it.
Thank you. I just want to remind the voters of Marin County that I ran in 2018, and obviously I was not elected, and the people that were elected promised to improve the mental health facilities at the hospital, which are really lacking. There's not enough beds for the actual citizens of Marin County. So unfortunately, people get shipped out to other places like Santa Clara County to Good Samaritan Hospital. That happened to me personally. So I can tell you firsthand that what was promised did not happen. They were also talked about having specific prisoners' quarters that were more clearly defined. And my understanding is that didn't happen. I'm actually going to do something. Everybody makes promises when they run. I'm actually going to do something. And I think people in Marin County really can get behind me on that, because I have such a unique platform. My platform is actually to do what the oversight board is supposed to do, and that is oversee the corporate board and make sure they're doing what the people in Marin County stand for. And that includes supporting the people in their medical needs and being a green hospital. And I want to make sure that that happens. Thank you very much for your support and your vote. I'm a woman candidate. Please support me.
All right, we're moving on. Ed, you're next. Please unmute your mic.
I would like to thank the League of Women Voters for this opportunity. The COVID-19 pandemic is transforming the practice of medicine, and the status quo we knew earlier this year is gone. The evolution of healthcare that is beginning now will require a deep understanding of the biology of disease and a profound understanding of viable practice alternatives to ensure patient safety, high quality of care, and affordable alternatives to what is currently defined as the standard of care. I spent 10 years using DNA technology doing immunology research at Stanford, and I also have a very strong clinical background. The future of medicine will be defined by those healthcare workers currently on the front lines of the fight against COVID-19. I have been directly involved on the front line since the beginning of COVID-19 pandemic. I have directly participated in many significant and fundamental changes, which have never before been seen during the lifetime of any practicing physician. Your support for my campaign is an endorsement of the importance of how we practice medicine in Marin over the next decade and beyond. Thank you very much.
Thank you. Anne, unmute your mic and give us your closing statement, please.
Yes, I wanted to remind folks that I've been a nurse for 41 years in both med-surg, labor and delivery, cardiac care, and infection control. I've been a healthcare attorney for 32 years. Hospitals are highly regulated, and my knowledge of healthcare law and regulations is very helpful to the board during our meetings. And the laws, as everyone should appreciate, are designed to protect the patient. And as a nurse, I'm the patient advocate. And I believe Hank and I have the qualifications, experience, and expertise that's needed during this time of transition with a new CEO, a relatively new CFO, and a new hospital. Now is the time for stability and civility. Thank you for your support, and thank you, Marin League of Women Voters, for allowing us to debate tonight. We very much appreciate your time. Thank you.
All right, Hank, your closing statement.
I have been on the board for 12 years, and I want to continue to serve. I think that I have the experience and the knowledge to do that, as Ann has pointed out. I want to serve the community. I've always had that feeling that it's necessary for somebody who has been as successful as I have to do that, and that's what I want to do. But I also want to underscore the importance of Ann's candidacy. Ann is a RN and a JD. This is a wonderful combination. She has added stabilization and productivity to our board, and she should continue to do it. Frankly, I think we have too many MDs on the district board. Thank you for the opportunity to talk tonight.
Thank you all. That concludes our forum. Thank you to the League's Health and Human Services Committee for their help in organizing tonight's event. To Aging Action Initiative for their support. Thanks to the candidates for participating. To Elaine Biagini for timekeeping. Doug Cooper and Greg Brockbank for reviewing questions, and to Nancy Bell and Robert Dietrich for Zoom support. And a special thanks to the team at CMCM TV. We could not have done this without you. A video of tonight's forum will be posted on the League's website in the next few days. Slide 5, please. For more information about the election, the candidates, and ballot measures, visit the League's website at marinlwv.org and click on the Voters Edge logo. Here are some additional recommended websites. Thank you. Thank you again for joining us tonight. And most importantly, thank you for voting. Thanks to everyone. Good night.